And I want to talk to you about teenage resistance, and I want to tell you that resistance is a wonderful, wonderful thing. I am more concerned clinically about a teenager that is too compliant and agrees with everything that we say, and at least superficially follows all the program rules and does everything that everyone expects them to do. In fact, and I won't get into details about it, but the one really kind of outstanding tragedy, loss that I've ever had in my practice was of an over-controlled, inhibited, fully compliant client. And I don't know if I'll ever get over it. It was a very horrible experience, but the warning signs were there, and I tried very hard to provoke this young person to break out of that mold and to in fact resist many of the suffering that was inflicted upon her in her life. But in any event, I love it when a teenager comes into my office and they're just full of vinegar, and as my old clinical mentor friend Walzak used to say, spitting bullets. I think it's absolutely fabulous, because with every resistance that they give me, I have material, I have something to work with, I have a clue to their suffering, and why should they trust us? And why should they be willing to give up the substance that's taking care of the symptoms that they're suffering with? I mean, why on earth does that make any sense? Why on earth would they want to get sober? It doesn't make any sense at all, does it? Unless I can offer something at least equal and maybe eventually better, I think they absolutely should resist with piss and vinegar and every other thing that they can do. And didn't know this was going to come up, but I am going to go into the stages of change. I do a lot of staff training, and one of the things that I constantly get eval comments about it is people love to really get into the stage change theory. And I think we can all forget this personally, but it's a wonderful way for me to stay motivated professionally and not burn out. I really feel that my goal as a clinician with teenagers who are resistant is to move them simply from one stage to the next stage. If I feel that in any way, shape, or form I can engage them and move them from pre-contemplation, and I'll tell you that's how most teenagers come to my office. You know, they've all been set up by the police, or their mother's out of control, or they only smoke pot 15 times in their life. They just happen to get caught every 15 times that they smoke pot. And it's hilarious, but most of them are in pre-contemplation. Very rarely will a teenager have, some internal motivation. It's all external motivation. They're there on a court order, or they're there because the parents have discovered their, hallucinogenic lab in the basement, etc. That's a true story. And, sometimes even in the first assessment, if you can, I'm going to get into assessment a little bit, but I'm really going to kind of just tease you with information now. We don't have enough time. But even in the initial assessment, if you can get some of what Ed and Mark were talking about, some of the self-medication hypothesis just out there as a what if to a teenager, they grab it right away. And I was talking to Ed actually right before the presentation, which again, he didn't know I was looking for some soothing, so I wouldn't be anxious. But that teenagers, I think, are actually easier to work with than adults. And I'm always surprised when my colleagues tell me, I don't want to work with teenagers, there's so much work. Because they're so close to the genesis of the self-medicating pattern that they're stuck in, that they can tell you, oh yeah, I remember exactly when I started smoking pot every day. It was right after my friend died in a skiing accident, and I was so effed up and whatever, and before that I was doing it every once in a while, and that's when I started self-medicating. I mean, they'll just come right out and say it. Where an adult, perhaps who's been self-medicating for 20 or 25 years or 10 years, often has alexithymia, I stepped out, you might have talked about alexithymia. They'll have no sense of when the medicating first started. And a teenager often, if given the self-medication hypothesis just out there as a question, will often be able to even pick the exact time in their life when the parents started going through a contentious divorce, when a sibling died. They'll just come right out and say it. And I gotta say, if you can get them to that point, they're already hooked. Even though they don't want to get sober at that point, but at least they get a clue that, as Ed so nobly points out, you're already asking them, what do you like about your drug of choice? And I go even further. I ask teenagers, what do you love? What do you love about weed? What do you love about this or that and the other? And then they're like, cool. And then it's hilarious because then they become completely disinhibited. They tell me all this information that would have taken like a year to get, right, about all the drugs that they do. We used to look at, preparation just means, if you're not familiar with this, that you start thinking of the pros and cons of using, and I'm going to give a shout out to DPT, very good at that, looking at the pros and cons of continued use versus abstinence. But in the beginning of my career, and this still kind of irks me, but most treatment centers, if you weren't in active quitting, wouldn't admit you to treatment, or wouldn't allow you to come into treatment. And so at least we've come a long way, baby, with that. And relapse is a natural part of the history of recovery. I've had one adolescent client in, this will be 26 years I'm working in the field, who, as far as I know, and I haven't talked to him in about 5 years, so that it could be false data that I'm presenting, but I think reasonably so, because he's 39 years old, so I don't know how that happened, but he survived a fatal car accident where his two best friends died in the front seat, and he was inpatient for 6 months. Actually, he was in a coma for a while, and then he was inpatient for 6 months after that. And he's a funeral director today. How interesting is that? And a grief counselor. I know, that's what believe me, poker face when he came to my office to tell me his career choice, but I think I pulled it off. And he stayed sober for, the ensuing 26 years. But every other teenager that I've ever had as a client, so I hope this makes you feel good about your competency, right, and your effectiveness as a clinician, they relapse. And in fact, it can be the most powerful part of the recovery if it's handled well by the treatment relationship. And then maintenance is what we talk about when someone's had stable recovery. Kurt Vonnegut Jr., who we lost last year, I think Billy Crystal says this, or Billy Pilgrim, I'm sorry, in one of his novels, Bad chemicals and bad ideas are the yin and yang of madness. And I love that phrase because it talks about the self-medication, the effect of the drug, and also the false beliefs and the false beliefs about self.